So welcome everybody. I welcome you on behalf of Pancreatic Cancer Europe and Cancer Patients Europe to this webinar. We are very happy that the webinar and the topic showed quite an interest. We had a lot of people interested in this topic and registering for the webinar. So I'm Luisa Pagano, and I'm the Secretariat Coordinator at Pancreatic Cancer Europe. So my role here is to facilitate the management of the webinar. Just a few notes and rules before starting officially. All of you as attendees are muted, and you are not allowed to turn on your microphone, and this is a rules so to facilitate a smooth development of the webinar. If you want to comment or to make any questions, and you are invited to do it, please use the chat. We collect all your comments and the questions for the Q&A sessions that is at the end of the panel discussions, and we will be happy then to answer your questions. So we are ready to start. I would like to welcome the first speakers to the webinar. We will start with Jacqueline Daly. She is the Vice Chair of the Board of Directors of Cancer Patients Europe. Thank you, Jacqueline, for being with us. The floor is yours.
Thank you, Lucia, and good afternoon to everybody. Dear participants, members of the European Parliament and Commission, patients and experts, on behalf of Cancer Patients Europe, I am delighted to welcome you to this webinar on the role of EU healthcare technology assessment in national healthcare. Since January, we've been witnessing an important evolution, not only for the HTA process itself, but also for patients' involvement in decisions that directly affect them. With the adoption and progressive implementation of the EU HTA regulation, patients can have a stronger, more structured voice in this process. They have the opportunity to bring their expertise, their lived experience, their perspective throughout the assessments of new medicines, therapies, and treatments. After all, who can better illustrate real-life benefits, side effects, and impact of health technology on patients but themselves? The EU HTA regulation formalises what has long been evident. Patients are experts. They must not be excluded from processes that will ultimately determine how they survive a cancer diagnosis or influence their quality of life and access to care. At the same time, as Commissioner Verhey underlined, patients need quicker access to innovative and life-saving medicines and medical devices. The EU HTA regulation is a crucial step in that direction. By harmonising steps at the EU level, it aims to reduce duplication of work, accelerate access, and address long-standing disparities. Faster, cleaner, more efficient processes, that is the ambition behind this framework. This is truly a milestone. At CPE, we are now seeing concrete results of years of advocacy and collaboration to embed patients' voices in the heart of health policy. While there is still room for improvement, CPE and its partners within the stakeholders network remain fully committed to providing constructive feedback and working closely with the European Commission to ensure continued progress. Today's event is an opportunity to reflect on this process, to connect policy and patients, and to take stock of how the regulation is being implemented so far. So what do we expect from this event? Over the next hour and a half, we will engage in a rich discussion on how patient involvement would benefit the HTA process and how, in turn, this involvement contributes to faster, more equitable access to innovation. Following the panel, we will open the floor for a Q&A session to hear directly from you. By bringing together patient advocates, policymakers, and experts from the HTA stakeholder network, our goal is to connect different perspectives and foster a shared understanding. I warmly encourage you to take part in the conversation, share your experiences, and raise your questions. Your contributions are essential because, just like the HTA regulation itself, this dialogue will only work when we build it together. Thank you for being here, and I wish you an insightful and inspiring discussion.
Thank you, Jacqueline, for this warm welcome and presentations of the webinar, and for highlighting the importance of patients and patients advocates' participations in the HTA process. So then we go straight to the hot issues, and thank you to Maya Matthews for participating in our webinar and to introduce us to the state of the art of the HTA regulations and how the HTA regulations involves patients and clinicians. So a few words about Maya. Maya Matthews, she is the head of a Health Technology Assessment Unit at the European Commission's Health and Food Safety Directorate General since 2025. And she joined the European Commission in 2008, where she was held several roles in the field of EU health policy. Thank you, Maya, for being with us today.
Thank you. Thank you very much. Thank you to the Pancreatic Cancer Europe and to Cancer Patients Europe for hosting this very important webinar and for inviting the Commission to share with you, as you said, this very exciting and groundbreaking, innovative work that we're doing, really co-creating the process of involvement of patients in the HTA regulation. So, as you said, my name is Maya Matthews. I've been working on the regulation since 2022 when it came to my unit. And then I think also as a signal of how important the European Commission takes this regulation, a dedicated HTA unit was created in June 2025, at the end of June 2025. So next slide, please. I'm going to first give you a very brief overview of what the regulation is, what it aims to do, and then zoom in on the involvement of patients and clinicians, and then also leave you with the state of play where we are today in implementing the regulation. So for those of you who are not so familiar with the regulation, it applies from January this year. And it aims to create a common framework for procedures on how to cooperate between member states on health technology assessments. It aims for high quality, evidence-based decision-making, and the principles of transparency and inclusiveness are inherent in the regulation. Next slide, please. So the joint work of this regulation is really driven by member states. It's the member states who are doing a lot of the analysis, the scientific work, and the Commission facilitates this process through an HTA secretariat, which is based in my unit. The stars that you see there are where there is absolutely direct patient and clinician involvement. And these are 4 kind of buckets, I'd say, of the most important work, the deliverables of this regulation. The first one being the joint clinical assessment, which is really the report that is written by member state experts with the involvement of patients and clinicians on the relative effectiveness, and this is only the clinical part, so it's not the economic part, it's the clinical part, of new medicines which haven't yet been authorized. And this is a very important point that I think many people are not aware of, that this work starts before the new medicines have actually been authorized. These reports are basically comparing the relative effectiveness of this new medicine with the existing treatments. And there's a progressive start, because it would be impossible to start all of this from scratch. So we are starting with new cancer medicines and advanced therapy medicinal products. And in 2028, we will add also orphan medicines. And then the idea is that from 2030, it would be all centrally approved medicines, meaning that go through the application of the European Medicines Agency. Another very important piece of work that this HTA regulation is driving is the research component. And so we offer a service to companies known as joint scientific consultations. And this is a service that is for free. And it's basically companies apply or request to have advice on what should be in their clinical study designs, so that the joint clinical assessment process can be more efficient and effective. And I'm happy to say that we have already concluded one such joint scientific consultation. And then the 2 other important pieces of joint work are the identification of emerging health technologies, also known as horizon scanning. And here the idea is really to pool the intelligence of the different HTA bodies, so that the member states can plan better about what they see coming up in the future, so that they can have the right experts to be there at the right time. And then, of course, as I said, this is really creating a common EU framework. So for a common EU framework, you need common methodologies and procedures. And we have a very active group, a subgroup on methodologies that are working very hard to make sure that, as I said earlier, the work that is coming out of this regulation is of high quality. Next slide, please. And the aim, just to remind everyone, is, as I said, it's an aim to pool the expertise across the member states, to avoid duplication, to really build synergies, to ensure high quality and timely assessments. And then, as you mentioned, access is very important. So the idea behind this regulation is that these joint clinical assessment reports will be available for all member states to use 30 days after the Commission has authorized the medicine. And this is really with a view to supporting member states in their decision-making processes. So their health technology assessments, which add the contextual part, the economic evaluation part, all member states will be able to use this and will be able to focus on that part, because the joint clinical assessment part would already have been done at the EU level. And again, with high quality and with the systematic involvement of patients and clinicians. Next slide, please. So you may be asking now, how does this work, the identification and selection of patients and clinicians? And I do think that, just think for a moment, I think that this is the first regulation of its kind that has the systematic involvement of patients and clinicians in 2 of the main outputs of this regulation. And here I'm just going to walk you through how this is done. It's process, but I think it's important to take some time, because I want to acknowledge that we could not have done this work without the involvement of patients' organizations, many of whom are here today, because we have created under the regulation a stakeholder network, HTA stakeholder network, which has over 70 members from multi-sectoral groups. And within that, we created a working group just on the identification of patients and clinicians. And I'm very glad that many of you are here today. We have 25, these are voluntary, they chose to be part of this. We have 15 patients organizations and 10 clinician organizations. We've had 4 meetings to date, and the meetings are with the organizations involved, but also with the member state chairs, with the European Medicines Agency, and with the Brussels Center for Collaboration in Health. And Marcus Guardian is here, and he will also complement later on in the seminar about how we aim to make this as seamless and as user-friendly and as effective as possible. So what happens is, the first step is that we need to get the information from the member states subgroups on what kind of expertise they need. And this is usually based on the information they have received from the company, from the HTD, on the indication and on the type of product that they are seeking for authorization, or that they're seeking for joint scientific advice, consultations. And then, and this is where we've now created this group, in my unit, Julie Sponni, who I think many of you know now, and Lucrezia Tuis, they are the kind of leaders in this. They then send messages to the relevant organizations in the stakeholder network to ask them for suggestions, recommendations for patients or clinicians that would fit the type of profile that we're looking for. And usually we provide the conditions. And then, and this is where I can really say that it's working very well. It's very resource intensive, but we're really trying to find ways to make it more efficient. We receive all of the input from the patients' organizations and the clinician organizations. And then we contact the patients and the clinicians. We ask them to fill out a declaration of interest form through this very secure IT platform that we have. And then we build up a list of the relevant patients and clinicians. And then we propose those to the subgroup. And this is very important, because I think this also shows you this is not the Commission deciding. This is really taking it at a very European level. And the subgroup then selects the relevant patient and clinician that they would like to be involved in the particular joint clinical assessment or joint scientific consultation. And then once that person is selected, their name is handed over to the Brussels Center for Collaboration in Health. And this is the administrative body facilitating the framework contract, the consortium of all the HTA bodies who carry out this work. And this is so that the work of the patients and the clinicians can be compensated. So we understand that patients and clinicians are very busy people. And I would like to take this opportunity to already thank all of those who've been involved so far, because so far we have seen that there's a lot of engagement. We know that this is a new process, and we're just very grateful for all of the associations in the stakeholder network working group, but also the individual patients and clinicians who've been so motivated to be part of this. Next slide, please. And so just to tell you a little bit about where we are in this process. So we have at the moment 9 ongoing procedures on the joint clinical assessment. And you can see on the website, on the Europa website, we provide information, but we can only provide the information after the European Medicines Agency has validated the authorization. So it's similar to what the European Medicines Agency has on their website. With the novelty is that we also share with you the organizations from the member states that are carrying out the joint clinical assessments. And part of that is also to show and to give the signal that this is really being done at a European level. This is a really European work, because up to now, with 9 ongoing joint clinical assessments, we have 12 member state organizations involved. And as I said, the joint scientific consultations, we launched 2 requests for interest from the companies in earlier this year. And we have 7 slots identified, and the first products are now being finalized, the request. This information is highly confidential information, And I should say that all of this work that we're doing, because we're trying to be facilitating access, a lot of this work is happening when, as I said, the medicines have not yet been authorized. So we have to keep a lot of confidentiality and security measures in place. And just to give you some numbers, up to now, we have been in contact, thanks to organizations such as those of you here today and sponsoring this webinar. We have had individual contacts with 180 patients, and more than 30 patients, carers, and clinicians are currently involved in the joint scientific consultations and joint clinical assessment process. So I think we're getting to a stage now where we can learn a lot from this process, and I'd be very happy to also hear a little bit today. I know there's many people today who've already been involved. Just a caveat, please don't mention anything product specific in the webinar today. As I said, we need to be very mindful that many of the patients and clinicians, they have to sign confidentiality agreements because the information that they are being asked to give their opinions on, as I said, are highly confidential and commercially sensitive. Next slide, please. So to conclude, I just wanted to say that we are learning a lot, and we are very excited to be going on this journey with you. And already we've had a lot of learnings, I think, and we keep on tweaking a little bit. And so it's a learning by doing exercise. We think it's very important to use occasions like today to raise awareness about the HTA regulation to companies, but also to patients' organizations, clinicians, about how they can be involved, how this is really something that they can bring all of their expertise, as you said, and their feedback to this European level. And in this regard, we do recognize the need to follow up with more training and capacity building so that this really becomes the norm, and that this systematic involvement of patients and clinicians in this process will become easier and more effective as we continue on this journey. So thank you very much.
Sorry, I forgot to open the microphone. So I was saying thank you very much for these useful introductions and overview of the implementations of the HTA regulations. I'm very happy to see that many patients and patients advocates are interested in it and already involved. So let's hope to continue on this way. So we come now to a second keynote speech, and I'm happy to welcome Mr. Tomislav Sokol. He's MEP. He is a member, Croatian member of the European Parliament since July 2019. He is a vice president of the Intergroup of Freedom of Religions, Belief and Conscience, the EPP coordinator in the Committee of Public Health, and a member of the Committee on the Internal Market and Consumer Protection. He's also a substitute member of the Committee on the Environment, Climate and Food Safety, and the Committee on Constitutional Affairs in the European Parliament. And he is the European Parliament's rapporteur for the European Health Data Space, and the EPP Group rapporteur for the reform on pharmaceutical legislation. Thank you very much, Mr. Sokol, for being with us today, and we are very happy to hear to your contributions. Thank you very much.
Thank you very much. Thank you for inviting me. Also, most recently, the rapporteur on the Critical Medicines Act, which I think is also something very important that we are working on at the moment. Thank you for inviting me. Thank you for giving me the possibility to say something about the HTA. I'm sorry that I will have to leave when I finish my speech because of another conference that I have to speak at on brain health. So a lot of things going on related to health at the moment, which I think is a good thing that we are keeping the momentum going in the European Parliament. When we speak about health technology assessment, it's something extremely important. Since I did my master and my PhD at KU Leuven in Belgium on the topic of regulation of healthcare systems, patients' right to health insurance, cross-border healthcare, etc., HTA, cost effectiveness analysis, and all that definitely played a big role. So definitely. Enactment of the HTA regulation was a very important step in having more common European approach towards health technology assessment, but towards approval of medicines in the market in general. However, I will have to say that I think that HTA regulation is a bit of a missed opportunity. Unfortunately, because of two reasons mainly. So first, the final version was because of the council opposition of the big member states was diluted in a way that member states no longer have to, as it was in the original proposal, are obliged to accept joint clinical assessment reports, but they only have to give due consideration to joint clinical assessment reports, which means that instead of legal obligation, there is none in the final version of the text. Which means that essentially it's up to the member states to decide what kind of role they will give to joint clinical assessment reports. Of course, for some member states, I think this will be beneficial, especially for smaller member states, which will use joint clinical assessment reports instead of having to make their own instead of making their own clinical assessments. And in that sense, for a lot of small member states, this will be a good thing. But unfortunately, we lost the opportunity to harmonize more HTA on the European level. The second point is about the role of the HTA, in which I'm still a bit lost, because on one side, the safety and efficacy of medicines in the end will be decided and approved in the process conducted by EMA, and with the final decision for approval made by the European Commission. So essentially, EMA will say whether medicine is safe and efficient that it can be put on the market, and then based on that, Commission makes the final decision in the centralized approval process. Cost effectiveness analysis, for instance, how much money certain treatment costs per quality adjusted life year, which is the basis for making national reimbursement decisions. So what will be covered by the national health insurance systems will still be decided by the member states. So member states essentially will decide whether spending 50,000 euros for one quality adjusted life year is worthwhile to fund a certain treatment, to cover certain treatment in national health insurance. So this will remain a national prerogative. So HTA, covered by HTA regulation, kind of falls somewhere in between these two main processes which are essential for medicines to become available for the patients. So in that sense, for me, the role of HTA, since the regulation essentially excludes economic analysis of the treatments, essentially kind of, and what will be its final point and objective is still not completely clear to me. Be that as it may, my topic, and that is what the revision of the general pharmaceutical legislation and the revision and the EHDS could bring to the health technology assessment on the European level, is also something which I think is pretty important. First, when I speak about the EHDS. So the role of the EHDS to make data, much bigger amounts of data available than it is now for the so-called secondary use. So secondary use is the use of data not by medical professionals to treat individual patients, but but for research, for making policy decisions, and also for HTA. And in that sense, the idea of the health data space can really bring about much more data available for HTA than it is now. So first, what is important is, and I like to say that EHDS essentially makes health data a kind of a public good. So a public good in the sense not that everybody can use it, but that it can be used for public interest by those who fulfill the necessary requirements. So the idea of the EHDS is that data sets which are now lying around unutilized in health institutes, research institutes, in hospitals, in universities, will have to be structured. There have to be systematized. They will have this systematization and structure will have to be made publicly available and cataloged. So, for instance, if you are a researcher who wants to do research in Italy, and you need the data set on pancreatic cancer, and you see there's a data set available in Germany, you will be able to access this data if you fulfill the requirements. The requirements are that you are doing research for public interest, and that you use the data in a secure environment, and only anonymized or pseudonymized data can be used. That means essentially that when we speak about HTA, that also the same principles can apply to the HTA. That enormous amounts of data which are now not used, which are not structured, which are not systematized, will now become available for conducting clinical assessments in the HTA. So I think in that sense, EHDS can really provide a breakthrough, make much more data available, systematize and structure the data, and also what is important is the data is also interoperable. And the whole thing of the EHDS is that common technical standards, semantics, and certifiable interoperability of health data systems is made. Because one of the main problems with health data now is that between different member states, or even between the same member state, between different regions, it's not interoperable and cannot be used and cannot be shared. Now with the HDS, we'll create common standards, common procedures, common protocols, so that health data becomes interoperable, so that health data from one member state can be compared and used in another. Which means that also for reasons of health technology assessment, now much more data will become available under the same common standards across the EU. And I think in that sense, EHDS can really prove extremely beneficial for conducting of health technology assessment. We speak about that was my first point. On the second point, on the revision of general pharmaceutical legislation. So the idea of general pharmaceutical legislation is to stimulate more research, more innovation. It introduces certain concepts like unmet medical need, and definitely the idea of this system is to incentivize the developers, the companies, to conduct more research, to gather stronger body of medical evidence, and in that sense, and if these studies are aligned with HTA needs, fewer post hoc adjustments or additional data requests would be needed by HTA bodies. So the idea is that these new concepts and standards are integrated into the whole process of pharmaceutical reform, of approval of new medicines, and of course that if this is aligned with the HTA, then definitely the whole body will be much easier. The whole procedure for HTA bodies will be made much easier. So the idea is that these procedures work together, that they work jointly, and that the same standards are used. And if developers of new medicines invest in stronger comparative trials or real-world studies up front, then of course the job will be made much easier for HTA bodies as well. So this is more or less what I wanted to say. Additional thing, maybe just to make it clear, is about the transparency of data. So transparency of data, publication of results of secondary data studies is very important. EHDS provides a framework for that, and also stakeholder involvement. I'm glad that what was already mentioned in the discussion, that HTA regulation contains strong provisions of stakeholder involvement, and this is for patients, medical professionals, etc. This is something that needs to be welcomed. I personally tried to introduce strong provisions on stakeholder involvement also in the HDS. Unfortunately, there was a lot of opposition by some political groups against that, unfortunately. So the final provisions of the HDS are not as strong on stakeholder involvement as I would like to be. But still, there are some provisions that they will be involved, but they won't have a full role in the decision-making process as I would personally like it to be. But nevertheless, definitely strong involvement of stakeholders is something to be welcomed. We have that in EHDS, maybe even stronger in the HTA regulation, and I hope that we'll be able to all continue to work together to improve the system on the European level. So to sum up, I think that both the standards like unmet medical needs from the GPL can incentivize more robust evidence, which will also be available and useful for HTA. That EHDS can provide much more data, interoperables and structured data for the purposes of HTA, which is also something to be welcomed. And I hope that HTA regulation, implementation of HTA regulation will bring about more harmonization of clinical assessments on the European level, but I'm sorry that the final legal text is not as strong on harmonization as it could have been. But that's a typical story when big member states do not want to have a fully fledged European health policy, but that's something that we have to face every day, unfortunately. So this is what I wanted to say. I don't want to be overly pessimistic. I think HTA can make a real progress. I think the EHDS and the revision of GPL can help there. I think it will be especially beneficial for the small member states, so they don't have to duplicate and do things on the national level. And I hope that in the end, this will bring to the de facto more harmonization of clinical assessments across the EU as well. So thank you very much. I hope I didn't take up too much of your time, and thank you for inviting me to say something on this.
Thank you. Thank you very much, Mr. Sokol, for your input and for highlighting the critical points on HTA and also the impact of this European health data space can have on the HTA, as well as the general pharmaceutical legislation. I'm sure that the cooperation with patients, advocates, and patients organizations can support a better implementations of the HTA regulation. So I know that you have to leave, but if you can stay a couple of minutes longer, maybe just to hear the introductions of the panel discussions and see so what the stakeholders that we invited can contribute to the discussions today. So thank you again. So I'm happy then to introduce the panel discussions of today and to pass on the floor to my colleague Josephine Mossette from Cancer Patients Europe. She will be the moderator of the panel discussions. Thank you, Josephine.
Thank you, Luisa, and thank you to all speakers and for your excellent intervention and preventions. And it's my pleasure to kickstart the panel discussion. So we have a very packed panel discussion, as you can see, many speakers, but who will be providing really interesting insights on both the EU level, so what the EU HTA regulation looks like for patients on a European level, and then we will be going to a national level, so to really be able to bridge this European and this national level. And to kickstart this conversation, it's my pleasure to introduce you to Valentina Strabiello. Valentina is the CEO of the European Patient Forum, who are a member of the EU HTA multi-stakeholder network. And Valentina, to kickstart your intervention, a couple of questions. So as I mentioned, your organization is part of the multi-stakeholder network, and it would be really interesting for us to have an idea of what is the role specifically of patients or organizations in the network on ensuring the patient involvement. We had some points from Maya, but it'd be very interesting to get also the perspective from one of the members. And also, if you have some time, to also give us an idea of maybe some resources that you're putting forward to support patient involvement. Thank you.
Thank you, Josephine, for this invitation, and good afternoon, everyone. So Maya has mentioned some aspects indeed, and I can say patient organizations have already played a key role in the negotiation phase before the implementation of the HTA regulation started. So we have played a key advocacy role in ensuring and supporting meaningful patient involvement. Now that we are part of the HTA stakeholder network and that the implementation is in action, we further contribute to the identification process of patient profiles, as we are some of the key contacts that the HTA Secretariat has in place to identify relevant profiles. At the same time, we keep playing an advocacy role, promoting methods for patient involvement, and also coordinating this effort among patient organizations. As Maya mentioned, we are 25 patient organizations, and we are collectively trying to coordinate this effort because, of course, it's a completely new structure and framework. It's not self-evident that we are able to come up with a procedure. And so it took us some time to develop a procedure, to coordinate internally. And I feel so far it's working quite effectively. Maybe another element I wanted to mention is that besides the identification of patients, we play a role in training patients and coaching them. Once profiles become available, of course, there is a need for them to better understand what HTA is. And we try to also play that role a bit in advance before the engagement starts, because we need to prepare the community ahead of the potential engagement in a JCA or in a joint scientific consultation. So I would say it's a continuous effort that also implies, I would say, a bit of intelligence, trying to understand what the new JCAs might be, or the new joint scientific consultations might be. Of course, all of this information is strictly confidential. So we try, I would say, very openly to connect the dots with the information that is accessible and accessible to the public, basically. We have been quite successful so far in identifying relevant profiles, and the numbers that Maya has shared are quite impressive. I must say, when we started this effort earlier this year, I was not so confident it would work so well, but I'm very happy to see that it's working quite smoothly, even though we all acknowledge it's a work in progress. When it comes to the tools and methods, we constantly work to identify what can work to support patient involvement. And now, indeed, with Cancer Patients Europe and EPF, we are leading on a new project under HTA International, which is meant to develop recommendations and tools to promote patient involvement in JCA. But we have already produced a number of trainings under the UCAPA project and HTA for Patients projects. Both of them are U4Health program projects that were meant to really train patients that may be potential participants in the joint work on the European level. Of course, I would like to add all of these materials are specifically relevant to interaction on the European level, but it may be very useful also for patients that are active on the national level, because learning about HTA, I would say it's never enough. And so all the material that is available can be relevant to other patients as well.
Thank you, Valentina, for giving us this quick overview. And I warmly invite you, you or a colleague from EPF on this call, to share links to the resources you're mentioning. I think it would be very useful, and we, of course, would also be happy to share these following the call. And so then, to continue among our speakers, it's my pleasure to introduce you to Marcus Garden. Marcus Garden, who leads work at the Brussels Center for Collaboration in Health on engaging patients once they've been selected to join an assessment. So you are at the part where the patient has been identified, their profile has gone forward, now they're in the thick of things and they're working ahead. So Marcus, I know you have some slides, so you're more than welcome to share them and to give us this overview. And we're, of course, really interested in hearing about the resources that you are also putting forward to support patients in their involvement in assessments.
Josephine, thank you so much for the invitation. Just to double check, do you want me to share the slides?
My colleagues can do it as well, so I will let my colleagues take care of it. Thank you.
Okay, thank you so much. And again, thank you for the invitation. I'll try to keep it short and crisp, especially as the speakers before me have already, I think, outlined the most important things. So you can just skip ahead. This is just a promotional slightly self-inflated slide deck here. And then if you go to the next slide, that I think is much more informative. So you heard about the European process, you heard about all the HTA bodies that are part of it. And the HTA bodies formed a consortium to answer to build the system. They are all members of the coordination group. This is just sort of a different way to look at the same group of HTA bodies. And these HTA bodies have brought together have been brought together in a consortium. The consortium is led by the Belgium HTA body, and the Belgium HTA body created BCCH as an implementing organization to deal with all the administrative work. And this is sort of where the connection comes to what you discuss here today. So Maya so excellently showed also in her slides the very meticulous process that goes into identifying and selecting and confirming and bringing about the right patient, the right expert for the right process. And once the patient or the expert is selected, we see them come to us. And us as BCCH, and I have one slide to briefly explain to you what we, BCCH, do in the overall process. And then sort of I try to identify a little bit of what that means for you. The next slide sort of gives a very brief overview of what we do, and that is primarily support and project management for the processes and JCA and JSCs. So here we support the HTA bodies in their work on a very basic level. So we provide meeting spaces and help them with IT elements for communication and things like that. We provide meetings and reporting support. We are the primary contact point for administrative questions between the consortium and HTA. And we, of course, facilitate the collaboration between our members. But primarily and most importantly, we contract, or we are the ones that provide the contracts and the confidentiality agreements with patients and experts. And that sort of is one of our key tasks. And here I just try to dive in very briefly. Once the expert and the patient is selected, we are being informed via the EU IT platform of the email address of that individual. We then reach out to the patient and we try to establish contact. And once that contact has been established, we provide further information about the process, what is expected in that process, and we try to ensure that there is clarity about the process. All our information sets, be them in email or be them on our website, which I relate to in a moment, are of course coordinated with all other players in the field. So we are closely working together with the team of Maya and her great work there, so that this goes hand in hand. We equally collaborate thankfully with Cancer Patient Europe and other organizations in the field to really make also the material that we have on our website that was aforementioned from Valentina, who has been part of great initiatives there. We try to bundle that information set on our website to make it available as well, and try to provide as much support as we can. In the future, we hope to further build out our patient and expert hub. I'll show a brief screenshot of it in a moment, but what we try to do here is really bring together all the information that we can find and that is approved by the subgroups, but also by the Commission, and have a very good overview, not only for those patients that are selected, but also for anyone else who's interested in the field and is potentially interested in participating as an expert or as a patient expert in these processes. The next slide is very briefly to give an overview of what you as a patient might meet. So which actors in the field you might see. And I'm not going to go into depth of each of them because we've heard a lot about them, but it's just sort of to make you aware that these are the actors in the field from whom you either will receive information or you will hear about, or whose work you are influencing and whose work you are hopefully guiding in the right direction. So this is just sort of to highlight that our work is a small part of a much bigger role that others have to play. We try to be here in supporting you with the contract. We will provide you with the financial reimbursement of your work from a BCCH perspective. We will try to be in these regards, your one-stop shop. And if there are any other issues, we of course will try to be there for you and answer questions. And where we can't answer questions, we will make sure that any other of these players who have their own roles to play will provide you with the answers that you need. We see that as our support role here, and wherever we can, we will try to be out there and sort of be next and be beside you and in that process. And if you go for the last slide, I'm aware of the time. This is sort of a very brief summary in terms of what we try to do with our hub. The hub has two elements. It has a public side, again, that brings together information material that is out there, that has been approved, that is really a great resource. And we just try to compile it. We take no ownership of this. This is entirely up to those who have built it over years, and we can only applaud to the great effort that has gone into it. And we provide the links. We try to sort of bundle this information set. But then we also have a closed section, a secure environment, which we use for communication with selected patient experts. So here we really try to provide you then with your contract, the payment material, the payment information that might be necessary, or anything else that is important for the conduct of your work, other than, of course, information that is provided you by the colleagues at the Commission, which use the Secure EU IT platform. So that's really important to keep in mind. There are two platforms you will deal with, one from the Commission and one from us. We will deal with the contracts, the payments, and anything else that is related to that. And the work on the specific product is dealt with on the EU IT platform from the colleagues of the HTA Secretariat. And I'll try to wrap it up here. My main message is we are entirely grateful, and I personally always stand in awe about the great participation interest from patients in this process. I just, and Valentina, this is a shout out to you. I just remember the very first meeting of the Parliament Committee in 2016, I think it was, when we started to launch this entire procedure, about this legislative procedure. And since then, there was so much effort and energy from patient organizations, and to see now 180 already potential identified patients and experts here for the 9 products that we have assessed or are assessing at the moment. I think that's fantastic. We couldn't be more grateful, and from our side, we will do everything possible to make this process as smooth as possible. And yes, we're starting, so there might be some hiccups, there might be some bumps in the road. But please don't be shy. Tell us when you see bumps. We will try to smoothen them out as much as possible, and we try to be as responsive as we can. So thank you so much for being on board. Thank you so much for considering it. We hear a few more information on sort of how our website looks like, how the hub looks like. Once you are selected, feel free to go there. But even if you're not selected, or if you're just interested, you will find material there. We leave the information here with the colleagues from Cancer Patients Europe. They can share that with you, and we make sure that you have access to the public sector for sure. Thank you so much.
Thanks, Marcus. And thank you for the invitation to share the bumps. I am taking this up right now. No, jokes aside, thank you so much for this presentation. And we will also be sharing this material. It's my pleasure to introduce you all to my colleague, Frédéric, to provide you with an overview of how the process has gone so far. As Marcus has said, as Maya mentioned, some patients have already been involved in the identification process and have already been involved in assessments. And while the process is very new, as it's only been implemented since January, there are already some early lessons that we have been able to draw upon. And Frédéric, it's my pleasure to invite you to share some of those initial insights from patients. Thank you.
Yes, thank you very much, Josephine, and thank you for welcoming here. As mentioned by Jacqueline during her introduction, at Cancer Patients Europe, we see the implementation of the HTA regulation as a major step forward for patient engagement. And as part of the HTA, EU HTA stakeholder network, CP works closely with the European Commission to ensure smooth transition, especially by identifying patients and experts for joint clinical assessments and joint scientific consultations, and to better understand how this process unfolded. And since our role pretty much stops in a way after the identification process, we conducted a survey among the patients we have contacted, and our goal was simple. It was to learn how they experienced their involvement and how the process could be improved. And the good news is that the results are pretty encouraging. Respondents gave an average satisfaction rating of 4.1 out of 5, and most expressed their willingness to participate in the process. So they particularly appreciated the accessibility and responsiveness of the HTA Secretariat, as well as the support received from the members of the stakeholder network. And between the first and second identification rounds, communication became clearer and better structured, thanks in part to the Commission's fact sheet, which explain the HTA process and the status of GCAs and GSEs. And given that 60% of respondents were not familiar with the process beforehand, this resource was especially valuable. And as a last point, collaboration within the stakeholders networks working group was also seen as a positive and constructive through our results. But of course, there are still points of vigilance. So many respondents cited the language barrier as a major obstacle, as everything is conducted in English, and another 20% mentioned difficulties navigating through the EU login platform for registering, which sometimes almost discouraged participation in a way. And also, very short deadlines were also an issue for the conducting of the identification process for experts who could take part in GCS and GACs. But however, these challenges were acknowledged and addressed since the survey, which has been conducted in June, to recontextualize a bit. We've seen genuine openness from the Commission and the HTA Secretariat. They extended, for example, tight deadlines, improved communication tools, as seen with the fact sheet I've mentioned, and acknowledge administrative burden, such as processing with documents, like the declaration of interest, for example. So this shows a willingness to listen and adapt, which is exactly what implementation should look like. And at CPE, we strongly welcome this openness and trust that future identification processes will continue to build on this constructive feedback, so the patient's voice are not left unheard. And in this context, we remain optimistic. The improvements we have already witnessed show that this process is dynamic and evolving in the right direction in some way. So this is pretty much what can I say about patients' involvement in GCAs.
Thank you, Frédéric. So some good news, things are already moving ahead. Process has been going well from the patient standpoint, but of course, we can always do better. And this is what we strive for, so that the process is truly inclusive and truly ensures that patients have a qualitative input in HTA assessments. And so now this was me wrapping up the European section of this panel. And of course, this discussion was about what does it mean at a local level? And this is very important to make sure that we understand, okay, but there's this EU HTA regulation at the European level, but locally, what does it mean for the patients in the different countries of the EU? And I'm delighted to now open the discussion to more national level speakers. And to kickstart this conversation, delighted to introduce you to Alessandra Loscalzo. Alessandra works for the Italian National Agency for Regional Healthcare Services, otherwise known as AGENES, and she's specifically working on medical devices. And I think there's some very great initial learnings from the Italian side. So it's a pleasure to have you here. And so my two questions to you are, what is the patient involvement in HTA look like in Italy up until now? And what has been the impact on the EU HTA regulation on patient involvement in HTA in Italy? Alessandra, the floor is yours.
Thank you. Good afternoon. Thank you for inviting me and to give me the chance to share our experience. How was the system before and how the system is now? The HTA regulation and the governance structure and the European system and the implementation we are seeing now had an impact on our system and on HTA patient involvement, which was disruptive, I can say, because before, until now, I mean, because it's a toddler, we are now in the process of doing things in a new way. Before, the patient involvement in our assessments was fragmented, was not systematic. We decided to involve patients on an ad hoc basis when we had resources, and you never have resources. And when the policy question from the Ministry of Health were to focus on the social domain, we think about the famous core model, the UNETA core model. So when we were asked to involve, and it was like the 10% of the reports we involved. This means that at the time, we didn't involve patients, we didn't collect their views when we did assessment, that they were just focused on the clinical domains. So this was the situation before. What the HTA regulation with its example has done to our system. We have learned two lessons, basically. First, that we can involve not only patients, but all stakeholders, so the entire society that is around the HTA, at a systematic level and at a strategic level as well. So they can have their voice heard on the program for HTA at Italian level. I will tell you something more in a bit. And the other lessons learned is that we can involve patients not only when we have the social domain focused on, because there is a policy question on that, but also when we have a joint clinical assessment, when we focus on the clinical domains. And so I think that this will improve and will make our system more inclusive. So for the first level, at a strategic level, what we have done, 2 years ago, we have approved a national program for HTA medical devices. And in this national program, we have a new actor that was not present before, and it is the stakeholder network, the national stakeholder network. And AGENES coordinated this network. We had the first meeting last week. So we are at the very beginning of our path with all the stakeholders. We have 41 organizations within our network, scientific society, patient associations, organization active in health. And it was really a meeting that gave us the chance to heard their voice on the entire program. So not only on the single assessment, how they can, what they need, what they think that can be improved. So it was really an inclusive process, and it gave us the chance to hear what they have to say, all of them. Of course, the patients association that are present for the patients part. At a report specific level, what we are doing, we are using and adapting to our system the templates, the process, the methods that we are developing in the JCA subgroup, basically. So we are now producing 2 new reports. Those 2 new reports are focused on the clinical domains, but for the first time, we decided to have a public call to involve experts, patient experts for the scoping phase. So in 2 reports that they are the first 2 that before didn't provide any involvement because we were not asked to focus on the social domain. Now we are involving them. I have to say thanks also to the stakeholder network at national level, because this is a channel to find experts, patient experts, and it is a channel also for a new dialogue and for an HTA that is more inclusive also at national level. So I think that the European system has been very important to improve our way of involving patients in Italy. And I think that this will be better in the next year.
Thank you so much, Alessandra. And it's very encouraging to see that 9 months into the implementation of this new regulation, we are seeing concrete change. And we're seeing at one national level, at least, that we're going from an ad hoc to a systematic involvement of patients. I think that's extremely encouraging. And this is a very concrete change. It's very tangible, right? So this is excellent and very interesting to also hear that you're adapting processes. So this is a clear illustration of how change at a European level can lead to change in a national level, which is the whole goal of this regulation and this patient involvement. So very encouraging words. Thank you so much, Alessandra. And this brings me to have another speaker, Susan Tippen from the German GBA, which is the General Joint Committee. And Susan works at the unit on patient participation. And so, Susan, I'm going to have similar questions to you as for Alessandra. Very interested in hearing from your end, from the German perspective, what does patient engagement in HTA look like in Germany? What are specific measures that the GBA has put in place? And are there any early lessons that you can share with us on how the EU HTA regulation has been informing or not processes in Germany? Susan, the floor is yours. Thank you.
Yeah, thank you very much for the invitation. I prepared some slides, but I think it's not in much time to go into it because it's very complicated for the German perspective. Because we're doing this since 2004, now 21 years. We do early benefit assessment here in the GBA Federal Joint Commission, and it's an 88 process, and we are a decision-making group. So we have now in the moment minimum of 300 patient representatives from 100 of patient organizations. We have today a session now, we have 25 patient representatives being involved in the meeting with all the stakeholders. And so we discussed all the important issues. And we prepared as well here in the committees the PICOs, which is the most important thing to get the right PICO. That's the most important thing for the end. And so it's not very new for the German side. Since 2008, there is a special patient participation staff unit here in the GBR. We're only responsible for support patient representatives. We're about 15 people here working from different kind of profession. We do since 20 years training courses, and we do training in evidence-based medicine, special things we need for the German, because we have very, very much things to support. We talk about methods and medical products and pharmaceutical products. And so everything which we do here and decide here is for every German patient, the law, for instance. But we first started because the German law said the GBA has to implement patient representatives. And for me, from my point of view, what I see is the most important thing for me is the patient's organization. They decide who comes to the committee. Not the stakeholder, not the working group, not the patient organization, this person is the one who said and represented the indication. And what we had as well, we have patient representatives there for the specific topic, and we have general patient representatives, because you can't leave them alone. This is what we know from 20 years now, because the discussions that we have here is so complicated and so high on a statistic level that you need both. You need the complete and really competence for the patients, what is really the living with the disease, and you need something to translate this into the language of a committee. And this is because when we get the clinical joint assessment from the EQUIC, it is still now, because every new active substance that comes on the German market has to put in a JCA report. Then the EQUIC says it has a high benefit, middle benefit, low benefit, no benefit, always compared to the standard therapy. We can change everything here. Yeah, because evidence follows the price. That's what we learned. It's all about the price. So you can put the evidence in this way and in that way. And so it's a hard discussion for every decision we make here for every new active substance. So they're quite trained. And because we then know what's new is the PICO. We're sad about the PICOs at the moment, because before that we could bring more importance for the patient into the PICOs on the local level, which are the most important PROs, patient-reported outcomes. But now on this national level, everything from our perspective, we said there's nothing standing inside there. They just says comparator is this, endpoints are this, and look for the right instrument to find it out. So before we had more income from the patient to say, we want to see this patient-reported outcome. Fatigue is very important for multiple sclerosis. And it became real, quality of life. We were the first person who said, we want quality of life in the studies. So we now because on the national level, for me, for myself, for instance, I'm not so quite familiar with the European level. But we would like to bring more input from the German representatives since 20 years, and they're very good. But you need to support them. You need to support them. You can't leave the only. But we feel is one sentence I have to say, because with the we have this written input from patients to the report. I would say there is no influence on that. What we think here, for us, the discussion in the committee and to fight directly with the payer and the doctors, that's more important. But it's my special German view of it, because I think it's so different. So it's very hard but I can understand it's very new for you, and it can put an input. It's very important. Thank you very much. Maybe the slide would be helpful, but I know it's no time.
Thank you, Susan. Thank you. We were indeed ambitious with the speakers. So, to quickly summarize what you said, I think it's really interesting, and this is something really important for everyone to be aware. Patients can be involved in HTA also at the national level, which can also influence discussions at the European level. And Susan brought forward a very interesting and really important element called the PICO. And for those of you who are not aware, the PICO is a research question that guides the HTA discussions. And what does PICO stand for? PICO stands for Patients, Problems or Population, Intervention, Comparison, and Outcome. And as Susan rightly said, PICO is central to HTA. And this also brings me to mention what Valentina was saying earlier on a project we're leading on HTA International, which is to make sure that patients have more of a say on PICO. And this is obviously led for example, in Germany at the national level, but we're hoping to also make sure it happens at the European level. So stay tuned. This is one of the initiatives that we are leading on also at CPE. And having said that, I think it's really important to also get the patient perspective on what patient involvement in HTA looks like. And it's my pleasure to invite Iga Rawikia from EuropaCall in Poland to share some input and insights into what patient involvement looks like in Poland and what are some learnings that you can share with us. Thank you very much, Iga. The floor is yours.
Thank you. Thank you very much for the invitation. And to be honest, I am very proud to share my presentation with you and the Polish perspective. Just the question if I will have the slides. I was said that I will, so maybe we will wait a moment.
Yes, can you see the slide on the share screen?
We can't see them yet, Anna.
No.
Okay. Just a moment.
Okay, so in the meantime, I am Iga Rawicka from EuropaCall Poland, and we cover GI cancer, so quite a lot, I would say. And we are involved in HTA assessment. So, okay, thank you very much. So next slide, please. Okay, so I received 3 questions from for today's webinar. The first one is, how are patients involved in HTA in Poland? So there are 2 ways: by invitation from HTA or proactively. So you can be invited and then you will be asked to assess current treatment of a given disease entity or patient problems and needs, or the benefits of using a specific medicine. Or you can involve proactively, which means that you can participate in transparency council meetings, simply registering and completing the industry conflict of interest, or by submitting comments on the published peer review analysis. I have not attended the Transparency Council meeting yet, but I have already personally was involved to share the assessment with HTA by invitation and by from our own point of view. Next slide, please. Thank you. So what are the main facilitators to patient engagement? So giving more time to prepare position on the matter. Education materials are written in plain language, for example, to understand health technology analysis or complete the declaration of conflict of interest. We can send the documents by email, thanks to including a trusted signature. The agency, as it's at its website, also explains how we can get involved in the work of the European HTA process, which is really very cool. We have dedicated patients action at the agency website, and information of any PAC's involvement is published both at the agency website and in the weekly newsletter. Previously, it was only the full report available. Next slide, please. And from the other side, we have barriers. And for example, there is lack of legislative authority, significant variation among patient organizations in terms of both legal status and level of expertise in HTA. For example, there are some patients advocacy groups who are really experts on the national and global levels, but others are not yet so experienced because they just started their journey with healthcare system. Also difficulties in meeting the formal requirements, meaning that they have problems with completed and signed declaration of conflict of interest, which finally results in the inability to submit the opinion. Next slide, please. The third question was, how has patients' engagement in HTA in Poland impacted access to therapies? Has it had a positive effect? Yes, it has. And how? Patients' voices provide a valuable complement to the evidence gathered in the HTA reports. Patients can share insight from their perspective, meaning on their lives with the disease or the impact of therapy on daily functioning. PAGs are empowered and they are really feel patient centricity, I would say. PAGs also have a real, I have written, although indirect influence on shaping drug policy in Poland, because obviously the drug policy is created by the government, the Ministry of Health, and it could be also created by the clinicians, by financial experts, pharmacovigilance, and by patient advocacy groups. However, for me, having over 25 years of experience in this market, I am still a little bit skeptic if we have direct or indirect influence, and we can discuss it here. So next slide. I would like to read the statement from the Vademecum for Patients, which was created by Polish HTA. It says, does my voice count? Yes, the HTA Council wants to hear from you about what is not included in the application from a pharmaceutical company or the agency's verification analysis. How has the therapy changed your life? What significant differences have you experienced? Perhaps after the therapy, you were able to return to work, or perhaps you gained an additional 4 hours a day without pain, which allowed you to reduce the dose of other medications or engage others to help you with daily functioning, or reduce the number of hospitalizations. Has this therapy given you hope? If you haven't participated in the therapy yet, but have other important information you would like to share, please register to attend the HTA Council meeting, which means that you have really possibility to share your experience. And the next and final slide, it says that increasing patient involvement in the HTA process is one of the Polish Health Technology Agency's goals. And here I would like to thank really a lot Polish Health Technology Assessment, Polish Health Technology Agency for their help and transparency, and to all 300 employees who work in Health Technology Agency in Poland, because they are doing a great job. Thank you very much.
Thank you so much, Iga. Thank you for this presentation. And I think these insights and this input, I think it's extremely interesting to also have this insight. What does it look like at national level in one of the many national levels that we have in Europe? And if I have to pick up one word from your presentation, it's empowered. I think this is a really, really important word, because we have a window of opportunity now. The EU HTA regulation has been put in place in January. So while there's some early lessons, I think it's really important that we also highlight what's going well. What does it mean from the patients? And I think empowered is one of the keywords I would like to keep in mind. And for everyone who has a time, you can see we are running over time, but I warmly invite you to stay on for 15 more minutes to keep the conversation going after our final presentation. And final presentation that is really key, and it goes back to what I'm saying about empowered. How do we make sure that patients are empowered in the process? Well, it's also by making the process more patient-friendly. And this is something that the Scottish Medicines Consortium has brilliantly been doing over the last few years with the development of the SIP, also known as the summary information for submitting patient groups, that you have developed and put in place in Scotland, Danielle, and you're also implementing in the UK. And so my question to you, Danielle, are, Can you give us an overview of what the SIP consists in and how it supports patient involvement? Thank you very much. The floor is yours.
Thanks, Josephine. Yeah, it's a pleasure to be here today. And as the only non-EU member state panelist, it's been good to hear about the HTA regulation that we've been looking at from across the channel. And I hope I've not been put as the last speaker, as the outsider from own sins. So, yes, as Josephine said, my name is Daniel. I'm the public involvement advisor with the Scottish Medicines Consortium, or SMC. And as just said, I'd like to speak to you today about the summary information for submitting patient groups, or SIP form, an innovation in public involvement in HTA developed by the SMC in 2016. At that time, we were developing new processes to better involve patients and patient groups in our assessments. And the SIP form emerged as a collaborative project led by the SMC, developed in partnership with our patient groups and with some input from industry. So the purpose of the SIP is to provide patient groups with clear, accessible information about the medicine under assessment, its licence indication, its potential benefits and risks, and how it may impact patients and carers in Scotland. So importantly, the SIP form is a mandatory part of the pharmaceutical company's submission to the SMC, and it translates complex clinical information into a more digestible format, helping patient groups engage meaningfully in our assessment process. So the SIP form includes questions that summarises what the condition is intended to treat, how that condition is currently managed in the NHS in Scotland, how the medicine works and what its mechanism of action is, its effectiveness and how it compares to existing treatments, how the treatment is administered, whether it's oral or IV, any potential side effects and how they're managed. It also details information on the impact of the quality of life for the patients, families and carers. And then finally, we ask them to include any information about any potential equality issues that should be considered. So we require that all information in the SIP form comes from validated sources such as clinical trials or other studies that is included in the company's submission. And the SIP really, it's not intended to be quoted directly by the patient groups or in the written evidence. Instead, it serves as a foundation, helping patient groups understand the medicine and supporting them in gathering real-world insights and experiences from patients. Speaking from my own personal experience as a former patient advocate myself, I've used the SIP to better understand a medicine. I've used it to help me design surveys that I've taken out to patient groups. And I've also used it to help develop interview questions to help me collect meaningful patient evidence for our written HTA submissions, and then also to use that evidence in any sort of meetings where we'd be representing the patient voice and sort of our patient and clinician engagement meetings, or indeed in front of our full SMC committee meeting. So in short, the SIP is a valuable tool that supports patient groups in contributing informed, relevant and impactful evidence to the SMC decision-making process. It is now a standard part of our public involvement approach, and we regularly hear from patient groups about how they value the SIP and how it enhances their understanding of the medicines that we assess. Thanks, Josephine.
Thank you, Daniel. And you were last but not least. I think finishing off with the SIP was really why we finished off with the SIP, was also to be more forward-looking. And we, make no secrets that we are advocating for the SIP to also be implemented within the EU HTA stakeholder networks the assessments at European level. And this goes back to what Valentina was mentioning earlier on our initiative in the HTAI. It's also to integrate this form. So we are taking learnings from you in Scotland and the UK. So thank you very much for your work and these initiatives. Now is the time for questions, the Q&A. So I see that many of the questions that have been asked by participants have already received answers. So thank you very much to the speakers who have provided these answers. I have one question from Patricia. Will the slides be made available? Well, we will be preparing a report and we will be making references to all the speakers' presentations that Lucia mentioned in the chat. So last chance to ask a question. Otherwise, we are indeed a bit over time. So unless anyone has a burning question that they want to ask here, and this is your chance, I will leave Alfredo Carato, PC Chair of the Boards of Directors, to make some conclusions and final remarks to close off this meeting. Alfredo, as I can see that there are no questions in the chat right now, the floor is yours. Thank you very much.
Thanks very much, Josephine. I think that the session has been amazing about this connection between politics and patients for an early and more efficient and equity access to innovation for the patients. And we started with Maya Matthews, chair of the HTA network, that explained us about the co-creation of the process and the involvement of patients and clinicians in this model, and the HTA regulations that raise awareness and based on the evidence-based decisions to be completed in a frame time of 30 days after it is approved, which is quite important because many regulations are being expected for a long time to be approved by local authorities. And all the things we have heard have illustrated us about the joint clinical assessment as a tool to increase training and capacity building for everybody. The MEP Tomislav so-called provided us the support of the European health data space and general pharmaceutical legislation to HTA, which is a tool that can be very helpful for both. And afterwards, Valentina from European Patients Forum talked to us about patients' organizations that are crucial for progress, and the training and coaching of them is a useful tool for everybody also. Marcus, which was representing the BCCH hub that takes care of the confidentiality, the contracts, the payments, and the support and collaboration of the JCAs and GACs to be under the HTA regulation has been very illustrative to show us this consortium of more than 30 HTA bodies now at the European level. Frederick from Cancer Patients Union showed us the results of this survey made in June, which showed the difficulties of the barriers that the patients could meet in learning how to collaborate, and showing improvement since then. So this is crucial. Alessandra in Italy also talked to us about the Patients Association in the HTA national processes and doing things in new ways. Involve the whole society, the entire society, as he said, and involve patients being more inclusive with them, which is also very good and I think a useful message. Suzanne from Germany gave us her point of view, as well as Iga from Poland, that showed us the two ways that patients could engage either by invitation or proactively, and which barriers could they face and which facilitators could they have. So this is also to learn from that. And the good message is that patients may influence on shaping drug policy in Poland. And there are more than 300 people working on that. So congratulations, Ika. So it's been a pleasure being here. I am happy that CPE and PCE have gone through this relevant theme that we are starting a new way of facing these tremendous things of making innovation accessible to all patients early and efficiently, and that we are trying to do it as soon as possible. Thanks very much to everybody.
Thank you, Alfredo, for brilliantly summing up a very rich conversation between everyone. And this is only the beginning. We hope to have many more conversations, and we hope to only have positive things to say about progress on the patient involvement, both at EU and at national level.
So thank you very much for this very, very inspiring webinar. Just technical points to end. So we will prepare a report of this webinar that will be sent to all of you, so that we can, and also the recording will be available on our YouTube channels. So then please stay tuned for further information. So thank you again for your participations, and we keep in touch. Bye.
Thank you. Bye.
Thanks very much, Lisa. Thanks very much, Josephine.
Thank you.